Heart failure is a debilitating and challenging condition for patients, especially as it afflicts a senior citizen-focused population. Moreover, this ailment is an enormous time and cost strain on the healthcare system, and this problem is largely a result of the consistent need for health check-ins and the expensive nature of healthcare. A solution that relieves the time and cost pressure while providing patients with an effective means to maintain or improve their condition is a compelling opportunity for patients and the healthcare community at large. Janus is an assistant for heart failure patients that automates a lot of the challenges dealing with heart failure. This application accumulates and digests data to better understand each patient's personal condition, and using that data can make certain predictions of upcoming complications. These tools allow this application to eliminate unnecessary health interventions or engage in a health intervention when data suggests it is necessary. Through a more complete picture of patient challenges, Janus can also simultaneously relieve strain on the healthcare community while improving the quality of life for patients through a simple, easy-to-use interface just by talking to it. So let's check out how this works. One of the key functions of this application is pulling in data to provide a more personalized, effective healthcare experience. And there are several ways we can pull in data. For example, we can connect to iPhone, but there are other popular ways we can get in data through open APIs on common devices that many people have, like a Fitbit watch. So let's see how this is accomplished in this application. Can we connect to my Fitbit data? And we're asked to authenticate, so let's say yes. When completed, we see the data we just pulled into the assistant. Now we're able to use this to provide a more personal, predictive healthcare experience. So let's take another step and see how this data can actually be used. We can also get data into Janus by writing a kind of journal entry, and this application will break apart our input and record the important bits of our speech to get a clear understanding of how we felt. Let me show you how this works. Can I write a journal entry?
How have you been feeling today?
I have felt worse today than previous days. I'm very lethargic and went up the stairs earlier and had to sit down for a while after because I was out of breath. I did sleep well last night.
Okay, that's good to know.
So
I'm a little concerned about your dyspnea in conjunction with your limited activity of recent. In the chart on the right, you can see how your walking activity has declined recently. I will communicate this immediately with your physician and reach out to you with a follow-up.
So Janus breaks apart our complex health updates and was able to do a couple things. First, the application noted that several of the details of my entry were negative, and it was sure to record and note that as it's an important data point in my health management. I did, however, also note that I had been sleeping well, and Janus acknowledged that as a positive development. On top of identifying our speech, this application smartly noted that in conjunction with more available exercise data, these symptoms might be signaling of a troubling development, and so the application can reach out to my physician via phone or text to coordinate a response. As a patient, I can also have Janus text or call me at regular intervals to remind me to perform treatment or check in via SMS message. Can you reach out via text to remind me to record an update tonight?
Yes, I can remind you later for an update.
And just to show you how that looks, you can see on the telephone here, I've just received a text from Janus on my phone via SMS, so it's really easy to talk to. Now last, Janus can also be leveraged from the healthcare provider side to quickly and easily get insights into a patient's up-to-date health on the fly, and it's quite easy to do this through voice. So let's pretend I'm a nurse and I want to get a quick snapshot of my patient. I'd like to check up on Brian. Can you show me his patient dashboard? So if we're a healthcare provider and we need to get real-time updates of patient health, we can get that quickly. As a result of more and better data, we have a clearer understanding of patients dealing with heart failure. And if we look to be in an emergency scenario or expect to be in the near future, the Janus assistant can quickly escalate the situation to relevant professionals, and as a result, we can improve patient adherence and quality of life while at the same time reducing strain on the healthcare system. That's all. Thank you.